Breast cancer is a nationwide scourge, but it affects one woman at a time, one family at a time. In one devastating moment, 4 short words, "You have breast cancer," changes lives forever. So while the nation needs the American Cancer Society and the National Breast Cancer Coalition, your neighbor, your mother, your wife needs someone closer, someone who understands what she is going through. The breast cancer survivors, both staff and trained volunteers from Sharing and Caring, have been there. They have shared your experience. They have shared your pain. They have shared your embarrassment. They have shared your fear and survived. And now they are here to care enough to listen, to walk, to wait with you, to fight for your rights to the best treatment available, to be there when you need them. And someday, after you too are a survivor, you can join them in sharing with others, in caring for others. That's what Sharing and Caring is all about. My name is Anna Krell. I am president and founder of Sharing and Caring. Sharing and Caring is a community-based grassroots organization founded 13 years ago when I was initially diagnosed with breast cancer. What does Sharing and Caring provide? First and foremost, we give hope to anyone who is touched by breast cancer. We provide education so that people no longer fear breast cancer, but truly know about it and know how to fight it. Ignorance is what creates fear. Fear prevents people from going for screening. Fear prevents people from reaching out for help. That is what we do here. We eliminate the fear through education. We provide free mammography screening for women who have no insurance. We navigate people through the complex process of the healthcare facilities. We assure that the screening they get is the best that is available, regardless of their ability to pay. Then, should there be a diagnosis of breast or ovarian cancer, we provide the support services that you need to survive. We will walk the walk with you throughout the entire process.
I came here and I made a world of friends. And I found out that people do survive. I came in frightened, terrified actually, and not even knowing that survival was a possibility. And they brought me through it every inch of the way. And when I was better, I said, if I live through this, I will spend my time pulling other women through it. And that's what I come to Sharing and Caring to do. And they provide this outlet, this facility, because we help so many people.
I was diagnosed in February of '99. I knew about Sharing and Caring, but I thought at first they were a resource group. I learned then that it was a support group. When I joined this group, I really believe it saved my life, because I live alone. I was afraid of so many unknowns. When I joined this group, the women told me that they had been through radiation, been through chemo, and it wasn't really all that bad. That gave me confidence. The different things they offer, we had dance classes in the past, things where we make wreaths out of flowers, and it's just an upbeat kind of organization, and it made me feel very comfortable with as a cancer patient.
They have so many other programs here also. They have healing your physical health. They have a program, we had exercise for the women, which was very important. We had a psychiatrist that did the meditation. We had yoga. We've had art classes. I mean, there are so many programs, but that is all in healing. And you have a sisterhood here. It's a bonding.
My mom's name was Rose. She discovered a lump in her breast. She had a mastectomy, and that's when she got involved with the Sharing and Caring for support, the support group. I used to go to the meetings with my mother because it was because there was a lot of questions that I wanted answered. There was a lot of things I did not know, because this was the first time ever in our family that somebody had cancer.
Sharing and caring is to link to those persons who still suffer from myths of not knowing what to do or where to go, and they don't go and get mammography on a regular basis. This is the organization where we can direct and make sure that you get the proper care, the proper treatment, and whatever is needed. Sharing and Caring provides the services here where if you are afraid, we will assist you in going. Someone will go with you personally to get your mammography.
They helped me get transportation for my therapy, because it was very difficult for me to take a bus and train to get to wherever I was going. I mean, it's not only the financial help, not only finding doctors, I mean, it's the emotional, helping me deal with it, helping me learn how to fight it. Unfortunately, you know, it's a disease, but if you find it early enough, I'm here even after a second time. And even if there's a third time, I'll still fight it.
We do pharmaceutical assistance, we do transportation, I do the support group meetings. No one is ever turned away. Whatever they come to this door with, their problem becomes our problem, and we solve it.
I'm a 17-year survivor, and I really felt, you know, I could always help everybody. 2 months ago, after 17 and a half years now, I went to see a doctor because I had a pain in my hip. And I says, hip surgery maybe. He tells me, you have metastasized. I said, metastasize? And he walks out the room. And I says, I can't believe this. I'm going to start crying. I said, what do I do? Who do I call? Who do I turn to? Called, of course, Sharing and Caring. The following day or a couple of hours later, Anna calls me. She tells me, go to a Queens Cancer Center. Okay, I'm trying to get that. Anna always called me. Janet always called me. Some of my friends didn't want to have anything to do with it. They felt, oh, that means that she might die. They don't want to bother calling me. They tell me they don't want to see me. So I says, I have no choice. I called up that Queens Cancer Center. All this, I feel, I have to thank Anna. I have to thank Janet. They have given me a gift of life. They guided me. They told me where to go. And before that, 17 years, I said, oh, I don't have to worry about cancer. But it does sit there. And I think I owe them a lot now.
When a member of the family is afflicted with this disease, Sharing and Caring really steps in and become a part of the family. We provide services for the children. We intercede in their schooling. We notify the principal and the guidance counselors so that they will get the special care that they need in this time. And also with the person, if requested, we even get involved in the final arrangements as well to make sure that the families and the children and all of the relatives, that we make an easy transition for them.
They were always giving me support, not only for me and my family. This is very important because you're like, you're lost.
A family member gets cancer, whether it's breast cancer, colon cancer, any kind of cancer. It's not just the person that's carrying the cancer, it's the whole family that's involved. You know, it's like a big umbrella over the family. So the whole family needs support.
It wasn't only the support, it was education. Learning how to pick my doctors, learning to ask the right questions, learning to keep my records. They brought doctors here. psychologists, nutritionists, oncologists, anything that related as far as the breast cancer, for helping us heal and teaching us the right questions to ask.
I used to ask them questions, they used to answer me. My mom, we used to ask about medicine, about certain chemos, radiations. Very, very supportive.
It is vital to the community, where it serves all of the people who are in need and cannot actually afford the necessary treatment, and they come here to us so that they can secure these services. I am particularly involved with women of color. These are the women who, for some reason, seem to be forgotten, and we are about to bring programs to the various boroughs citywide so that we can inform and educate so that so many of our women of color will not die from this disease called breast cancer.
Then we go to the BEAT program on the last Wednesday of the month in Mount Sinai, and there I talk to the Spanish women too, because some of them don't speak English, so I try to help them. If they call here and they have any questions, I'm here. They can call me, they could call me at home. Whatever we have, I'm involved in. Les suplico a todas las mujeres de este mundo que tienen que hacerse la mamografía, porque es muy importante. Si encuentran el cáncer a tiempo, siempre hay remedio. Por favor, mujeres, háganse la mamografía, siempre, cada año.
Si un doctor le dice a uno que uno tiene cáncer, uno tiene que ir a otros doctores para saber exactamente lo que uno tiene. Y este grupo, Sharing and Caring, le puede ayudar. Siempre puede decirle a dónde ir.
I believe that being part of a peer group, a support group, such as Sharing and Caring, provides enormous emotional benefit to the women who are suffering from this. And I think that this may improve on their overall care. We do come across a lot of patients who have experienced breast cancer, and we found that they were very much helped by the support group. And as I said before, having this kind of support really gets them through their circumstances, because their life has now changed. It's turned on its head. Our local physicians are of tremendous support, because many of the women that we see in Sharing and Caring do not have insurance or are underinsured. So access is such an important issue. And we have a network of physicians who are surgeons, medical oncologists, radiation oncologists, are radiologists who have been very supportive in providing their services really pro bono, and still maintaining the quality of care that is really required to combat this disease. So I'm very thankful for those loyal physicians in our community who have been so helpful.
I was diagnosed in 1993. I remember sitting in the doctor's office, and the surgeon turned to me and said, "Anna, you have breast cancer." At first I thought it was really a bad dream. I thought I was not hearing what he was saying, that it was not possible that at that age, at an early age, I would be diagnosed with breast cancer. And for those few moments when I heard the words, "You have breast cancer," my first thoughts are, this can't be happening. How did this happen to me? And will I live, or am I going to die? At that time also, my daughters were very young, and I was wondering, how will my family be affected? I think that was probably my primary concern. I couldn't undo the diagnosis of breast cancer. That was set already. It was diagnosed, no turning back. But what about my daughters? What about my husband? I mean, what are they going to do without me? Who will raise my children? I want to be the one to raise them. I don't want to die. This no longer should be a silent killer. It should not be a devastating disease. And it should not make you feel powerless. We have to be in power. You can't have your life ripped apart because of the words, you have breast cancer. You have to be able to have a support team there to help you, and not to have to worry that it's going to cost you money. It's not going to cost you 1 penny. It's enough that you have breast cancer. You shouldn't have to worry anymore. Your only concern should be to get through the treatments and have a wonderful, full life. And Sharing and Caring will be there to provide you with all the assistance you need throughout the whole process.